Welcome, everyone. It's so nice to see so many different names. It shows how diverse our community is and spread all over the world. Thank you very much for joining us today. My name is Marina. I'm currently the secretary of the Retina International Youth Council. I also sit on the board of Retina International. For quick descriptions, because I know we all here have either we're blind or low vision, or maybe no, but I am low vision. I have Stargardt disease. I have fair skin. I'm in my 30s, and I have curly brown hair. I'm wearing kind of a sweater because it's cold where I am now. It's Brazil, it's spring, but it's cold, unbelievable. And I'm wearing a yellow glass, which helps me with the glare of these different screens that we have. Um, I'm very happy to welcome you here. I will hand over to Vincent so he can present himself. Then we'll briefly just say what is the Youth Council, what is this event is about, and kick off. That will be very quickly. So Vincent, welcome and tell us who are you?
Hi together. Glad to see so much people on the event. My name is Vincent. I'm as well from the Youth Council officers. I'm 32 years old. I come from Switzerland. I work as a physiotherapist. I have choriodermia. Actually, I am still progressing. I have brown hair, glasses, and actually I have a polo shirt on. Yeah.
Nice. So, this is the Retina International Youth Council. It's a council made of young people, so mainly between 18 to 35 years old. People who have an inherited retinal disease or are related to someone who has it, maybe family member, child, anyway. And we sit together. We represent the institutions we come from. So Retina International is made of different associations around the world. For instance, I'm from Brazil, so I come from Retina Brazil, and people come from different places. And we meet a couple of times a year, uh, meet each other, understand our issues, and think what are the challenges that we face and how we can contribute to our main goal, achievements, objectives, and also how can we support Retina International in pursuing its goals, at the same time helping to foster future leaderships. We have an event every year. So there is the World Congress, we do this event in person, and once there isn't, which is this year in 2025, we do an online event. We have done several online events in the previous years. And you can check, just go to the Red International YouTube channel and you can see not only the youth events yet, but many other interesting contents. I really advocate for you to go there and see it. They're very nice contents. And for this year, we have planned 2 hour event, so we'll be here for a couple of 2 hours. We have a break in the middle, so don't worry if you get tired. I personally get some time with my head. I need some couple of minutes, so we will provide that. We are starting with Nabin Paudel, which is the head of research and programs at Retina International. Nabin is also an optometrist, has formation that is and some years of experience. Many publish and papers and really work hard on the field of Retina International, helping to push research on our field. And he'll be talking about PROMs. I think Nabin will present this much better than I am, so I will leave that to you, Nabin. And after Nabin, we have a break. After that, we go over a career session. We have a few panelists invited. I believe you will enjoy. I'm looking forward for both sessions, where you present a little bit about their careers. Vincent will be moderating that second sessions. And of course, we will have Q&A for both moments. Where Claire and Ellen from Retina International will be supporting us with raising their hands or giving the chat, etc. Please be comfortable. This is an event for us. I think there is no silly question, no silly comment. Please be comfortable to use the chat, or if you want to raise your hand. If you have any technical difficulties, just let us know. You can email or write on the chat, whatever you feel comfortable. I think the most important for me is that this event is for us, is for the community of Retina International. So please enjoy and be comfortable. And if you have anything, just let us know. So that's it. Nabin, the floor is yours.
Thank you very much, Marina, for that nice introduction. And I'm very much delighted to be able to present on the topic patient-reported outcome measures. Just a quick introduction, as Marina, I think, clearly mentioned about my background. In terms of appearance, I'm brownish, from South Asian origin, and I'm currently wearing a blue shirt with spots, black spots. Let's get started. I'm going to present my slides and try to be as much kind of explainable as possible. Hopefully you can see my slides.
Yes.
Those of you who
Thank you.
can see the slides, let's duplicate. Okay. Once again, thank you so much for the organizers for inviting me to speak on the topic of patient-reported outcome measures. In particular, I'll be focusing on retinal diseases, as I know that lots of us are relevant to the retinal community. And as Marina mentioned, I am the head of research and programs with the Retina International, where we lead educational and research programs in-house with partners, with patient advocacy bodies, and so on. So just a quick intro or outline of today's presentation. I'll just briefly start off with an introduction to PROMs. What are PROMs? A quick definition, which will be followed by why patient perspectives matter. I'll be talking about two types of retinal degenerative diseases and their impact on patients and caregivers. I'll be talking on current diagnostic methods, particularly the clinical methods, and why and where are PROMs used, and what makes a good PROM, followed by current existing PROMs in retinal diseases, and key issues with current PROMs, which will be followed by how can patients or patient representatives contribute in developing innovative tools like innovative PROMs or in the therapeutic landscape. And finally, end this presentation with a conclusion and question and answer or discussion. And okay, so let's start with what are PROMs. So basically, PROMs are patient-reported outcome measures. They're structured tools that capture patients' perception of their health status and the impact of disease and treatment on their life. So they are, as the definition suggests, they are patient-centered perspective, completely completed directly by patients without any interpretation from a clinician, providing a unique patient perspective. They measure functioning and well-being of the patient, which evaluates how patients feel and function in their daily lives, not just in the clinical parameters such as the visual acuity charts or contrast sensitivity or visual field. They complement clinical assessments, which means they captures aspects of health that objective clinical tests like visual acuity charts often miss. And they're valuable in retinal degenerative diseases because they can capture the impact of progressive vision loss on daily functioning, independence, and quality of life. So basically, PROMs bridge the gap between clinical measurements and the patient's lived experience. Now, if there are some clinicians or people who are more involved in research are not completely sure why we need patient perspective, I generally show them this image. If you can see this image, or for those who cannot clearly see this image, I'm going to explain what's in the image. On the left side of the panel of this image, there is a crib where a small baby is lying down on the crib, and above his head there are a few toys being hanged, 4 toys, hang toys. And on the side of the crib there are parents, the baby's mother and father. So the baby's mother and father think that the child is really enjoying the toys. But on the right side of the image, you can see that what the baby is seeing. He's just seeing the bottoms of the toys. He's not seeing the actual whole toys, but he's just seeing the bottoms of the toys being hanged. So that means, imagine the baby is the patient, and the child, the baby's parents are the clinicians. The clinicians, the parents, think that the child is quite enjoying the view, but in fact, what he is seeing is just the bottoms of the toys. And you can imagine if there is lots of room for improvement in relation to the engagement of the baby. That for him to be engaging more properly by seeing the whole picture of the toy. So that's exactly why patient perspectives matter. I mean, clinicians see from one point of view, but patients see from a different point of view. I hope that makes sense. So in summary, in terms of why prompts matter in retinal diseases, we do that whenever you go to attend a clinic, you will be going through clinical measurements such as visual acuity, optical coherence tomography, which is a photography of the retinal image, retina, fundus autofluorescence, and visual field. And when you do the prompts, the patient-reported outcome measures, there are a list of questionnaires that gives the patient perspective. And taken together, they give you a holistic health picture, a comprehensive understanding of the patient's life with the clinical measurements as well as the quality of life and functioning. So it gives a holistic health. That's why prompts can bridge the gap between the clinical metrics and the real world life of the patient. Now let's go into some of the common retinal degenerative diseases that we are particularly interested on. Age-related macular degeneration is one of the sort of degenerative diseases that occurs in individuals over 50 years of old. It involves breakdown of the macula, which is the central part of the retina responsible for clear and sharp vision. And it's classified into 3 stages. It's early, intermediate, and late. So the late stage presents as an atrophic, which is dry or wet, means neovascular AMD. And key clinical signs of this particular disease is the presence of extracellular deposits called drusen's, yellowish deposits in the retina called drusen's, leading to formation of new vessels or death of the cells. And I think what we are interested in this group, I think most of us are either representatives of inherited retinal disorders or researchers working in this field or people living with inherited retinal disorders. These are the group of genetic disorders caused by mutations in specific genes. They lead to degeneration and eventually death of retinal cells, particularly photoreceptor cells. These cells are the cells that are light sensitive. They transport the light sensitive to the electric signals to the brain. These diseases, inherited retinal diseases, affect 1 in 2,000 people worldwide. And the common conditions include retinitis pigmentosa, Stargardt's disease, Usher syndrome, Leber's congenital amaurosis, and so on. The one thing common in both of these conditions are they're both kind of degenerative conditions where the cells of the retina degenerate gradually and lead to permanent kind of visual impairment or even blindness. But both these conditions lead to progressive vision loss and can significantly impact the daily function of patients. Now, let's look at what are the impacts of these kind of diseases on the patient's visual function and quality of life. So when you go to clinic, you will see that the clinician, the optometrist or ophthalmologist or any other clinician will first of all measure your visual acuity, how far, the far distance vision. And in some cases, they can measure your low luminance visual acuity as well. They would do your visual field, which would determine the extent of visual vision that you can see towards the periphery. And in some clinicians would do sensitivity to light, and very rarely the clinicians would do facial recognition, reading, or mobility testing. But what actually people with these degenerative diseases are living with are various issues in their daily living activities, their personal safety around the house or in unfamiliar places, their overall health status, their work productivity at work, job loss, job reduction, their emotional well-being, which means anxiety and depression due to the disease, as well as social relationship. And these all comprehensively comprise of the quality of life. And this is what is measured by the patient-reported outcome measures. As you can see the distinct difference, in the clinicians only focused on distance vision, near vision, low light vision, but what actually translates by those vision is the impact on the real world day-to-day scenario where you have to deal with personal safety, your daily living activities like cooking, television, roaming around, your friendship, relationship, your mental health, mental well-being, your job productivity, and overall health. So as I mentioned before, these are the kind of diagnostic tests for inherited as well as to diagnose retinal degenerative diseases, which are particular clinical examination, including standard dilated eye exam to see the whole retina, the optical coherence tomography, which is a kind of an imaging test to determine the thickness of the retina, as well as if there is any disturbances in the alterations in the layers of the retina. Fundus autofluorescence means when they will project different kind of lights, and looking at the reflection of the lights that is reflected by the retina, you can determine whether some certain cells are dying or already degenerated and things. Similarly, in terms of functional tests that clinicians usually use Amsler grid for, particularly AMD, age-related macular degeneration. Visual acuity charts are common charts everybody know. Color vision testing and visual field testing. These all tests do the assess the visual function. In terms of genetic testing, particularly for inherited retinal disorders, they would do blood or saliva samples to confirm the IRD diagnosis, and also can lead to treatment decisions or prognosis of the disease, and essential for inherited retinal disorders. So again, a repetition of the earlier thing is like traditional assessment, like clinical visual measures, functional tests actually provide structural and functional data, but they may miss the full impact on patients' quality of life. How is this structural and functional alterations are affecting their day-to-day real-world activities? That's what patient-reported outcome measures try to answer. So now you might be thinking, how are prompts used? When and where are they used in practice? Are they used in clinical trials? Are they just used for research and things? They're used in a variety of purposes. So prompts can be used in clinical trials as primary or secondary endpoints in clinical trials. What does that mean? Primary or secondary endpoints, what does that mean? That means primary endpoints means that is the sole kind of outcome measure that determines whether a drug should be approved by the regulators or not. And the secondary endpoints mean that it is a complementary endpoint, complementary measure that will help the regulators to understand the impact of that particular treatment on another element. So primary is the one that the regulators or clinicians think that that's the that's the best measure, and the secondary would complement. So in commonly most of the oncology trials, cancer trials, use prompts as a secondary endpoint, and the survival of the patient or those kind of things as a primary endpoint. I'll come to that later in terms of what is the practice in clinical practice or in the clinical trials in the regulation in IRDs or in ophthalmology. So prompts can be used for evaluating gene therapies, the effect of gene therapies on daily living activities for IRDs. And this, in clinical trials, they give us a picture in relation to whether these treatments provide some meaningful benefit for patients when they perceive it themselves. In clinical practice, it enhances communication between patients and providers because it will give you the perspective from the patient. It uncovers aspect of vision and being being overlooked. Whenever you go to clinicians, it's rarely that the clinicians will think about your mental health status, and that's what prompts will provide you, the clinician, the measure of the mental health status due to the disease. It can facilitate more personalized care and shared decision making. So, as I mentioned, the mental health status, the productivity, and those kind of things, and even socioeconomic difficulties, relationships. So it helps to understand the far-reaching implications of the diseases, so that appropriate kind of pathway can be determined, care pathways can be determined. Now, in terms of regulatory decisions, health authorities recognize prompts in evaluating treatment efficacy. So regulatory decisions are these kind of bodies, the mostly government bodies that determine whether a particular drug that has gone through testing in human participants is okay to be approved and to be given to patients. So these prompts are used by these regulatory bodies to understand, is it just improvement in clinical parameters as measured by the clinicians, or is it the patient is seeing any benefit with the treatment? And they kind of consider these prompts as well as clinical measurements to approve the particular therapy. And there has been increasing recognition from the FDA, the Food and Drug Administration, and European Medicines Agency in considering prompts in approval processes. And as I mentioned before as well, it provides evidence of meaningful benefits to patients. It's just not the improvement in the clinical parameters, but also the improvement as perceived by the patient, so that the drug is providing some meaningful improvement. So what makes a good PROM? So developing a PROM is a time-consuming and robust scientific method. It goes through several iterations and scientific robot validation studies. So what does validity mean? So a good PROM means it is valid. It means does it measure what it's supposed to measure? That's the validity. In terms of reliability, is the measure consistent and repeatable? So if you fill a questionnaire today, and if you fill the questionnaire in 2 or 3 days, does it provide the same score? Unless the symptoms is kind of rapidly changing in day by day, the PROM should be providing a reasonable score within a reasonable margin. That's called reliability. And responsiveness, it's can it detect real changes in patient health? So it needs to, the good PROM should have kind of could be able to sensitive enough to be detect even minor changes in patients' health. A good PROM also needs to be quite well interpretable, which means the scores are easy to understand and use. And it also needs to be very feasible, that it is practical and understood by the patients and patient-friendly. So here are common disease areas where PROMs are used in clinical practice and in clinical trials. Oncology is one of the most commonly where the PROMs are used very widely. In asthma, in orthopedic surgery, chronic pain, and depression, PROMs are getting increasingly used. In ophthalmology, we see that PROMs are used in cataract, neovascular AMD, and dry eyes. And gradually, we're seeing a lot of recognition by the FDA, EMA, in relation to using PROMs in inherited retinal disorders clinical trials. They haven't been used in clinical practice for inherited retinal disorders, but they have been encouraged, the regulators have encouraged the kind of investigators to use PROMs as much as possible in the inherited retinal disorders clinical trial, so that it gives, because we know that this kind of inherited retinal disorders are slowly progressing condition, and it's really tricky to understand or to assess, measure the change in patient's perceived improvement in vision or health. PROMs could be a very useful measure in relation to if there are any meaningful benefits of a particular treatment in ophthalmology. So we're getting more recognition in the field of ophthalmology in IRD clinical trials to use the patient-reported outcome measures. And you might be wondering, are there any what are the PROMs that are commonly used in ophthalmology or particular retinal degenerative diseases? And one of the most commonly used patient-reported outcome measure was the National Eye Institute Visual Function Questionnaire 25. It's widely used in broad ophthalmic conditions called such as cataract, AMD, age-related macular degeneration, and glaucoma. But one of the limitations of this particular PROM is that it lacks specific items relevant to IRD people and people living with IRDs. And it has demonstrated poor measurement properties and lack of sensitivity for this group. Now, recently, there are a few patient-reported outcome measures that have been developed by different groups, different academic institutes. One of them is the Michigan Retinal Degeneration Questionnaire. It's a validated, but still this questionnaire hasn't been used in clinical trial, but I think they're gradually trying to adapt this questionnaire in clinical trials. Yeah. The other one is the Visio Pro or OPS reported outcomes. These are, again, patient-reported outcomes and observer-reported outcomes for non-syndromic RP and Leber's congenital amaurosis. They claim that they're co-developed with patient and caregiver input, and the Visio observer reported outcome is specifically designed for use with children, because children cannot complete the reported outcomes. The caregiver or the parent or guardian has to complete this questionnaire. However, as I mentioned, patient-reported outcome, the development of this patient-reported outcome measure is a scientific method, and we have seen that there's few issues with the current prompts in inherited retinal disorders, and we don't know whether these kind of prompts that have been developed recently will be approved or qualified to be used or to be used as a supporting or complementary endpoints as suggested by regulators, because we think that these prompts actually do not address all areas of impact. As I mentioned before, the people living with retinal disorders have to deal with this kind of lots of areas, but what these current existing prompts are focusing on are symptoms and some areas of mental health, but not all, and have not addressed their social relationship part, their personal safety, their work, and so on. And these tests are very time consuming because every person has to complete the same number of questionnaires every time, which is lengthy, and it doesn't consider the stage and age of the disease. So a person with mild disease also had to complete the same amount of questionnaire as opposed to somebody who is very severe in the disease state. And also this kind of reported outcomes are developed by clinicians or scientists. I'm not saying that they're not good in what they do, but I think, as I mentioned before, I think there are some areas being missed in these prompts. And I think if patients can lead these kind of activities, we can make sure that these areas can be included within the prompt so that overall holistic approach of treatment can be determined. Okay, now let's come into a little bit of practical element where you might be thinking, okay, I think this is interesting, like developing patient-reported outcome measures where we have the direct voice in developing drugs, in our care pathways, and so on. So how can people living with the disease, such as yourself or representatives, can contribute in developing prompts or in innovative therapies? So the first thing I would do is to get informed or educated about your disease condition as much as possible. I know not all of us would be scientists and understand the nuts and bolts of to the molecular and cellular level, but I think we can understand as much as we can to be informed about the condition. You can also get informed about the drug development and approval pathways, such as how regulation works, how health technology assessment works, and so on. You can also understand about the reimbursement pathway. So once the approval is done, so once the FDA and EMA actually approve a drug, then they would have to go to this health technology assessment where they decide on whether to reimburse the drug based on their kind of efficacy and what is already existing in the market and so on. So you can understand about that element as well. And also, what is the patient's or patient representative role in developing care pathways, in support systems, and those kind of things. If you can get informed in those elements, that will significantly help in your kind of proactiveness in getting involved in these innovative therapies and development of prompts. I would also suggest to be vocal about the challenges faced by our community and express potential solutions that you may work via social media, newsletters, blogs, or even journal articles. There are certain journals which are specifically focused on patient-centric perceptions. So you could talk about these conditions. You could do a systematic review if you're into research. You could do a narrative review. You can do a case reports or so on, and kind of get it out there as much as possible. And finally, you can express your interest as patient expert in FDA, EMA, and HTA bodies. So I've given them just these links where you can yourself register or get involved or find ideas on how you can get involved as a patient expert in these regulated bodies if you're interested in getting involved in the whole landscape to shape your care pathway. So there's a specific websites in FDA as well as EMA where they give you step-by-step process on how you can actually be an expert in and be in the committee where they can approve drugs or in terms of support systems and care. Okay, so and I have a good news for you. So Retina International regularly does this kind of educational activities where we teach all these elements, which I discussed earlier, about the disease condition, about the drug development and approval pathway, the reimbursement pathway, and the role of patients in therapeutic innovation, and which includes development of prompts and other tools as well. So we're currently accepting applications for our education hub, which is a 4-month-long program with faculties all across the globe who are clinicians, scientists, professors, patient advocates from not-for-profit organization, and leaders in this space. And if you can scan this QR code, and we will send further details in a follow-up emails to all of the audience in relation to, if you're interested in learning about the Education Hub, we're currently accepting applications. And again, this is a 4-month-long program, which will take you through all these elements that I discussed earlier on how you can get informed or educated on your disease condition, on drug regulation, HTA bodies, clinical trials, patient registries, and the importance of having patients in these decision-making platforms. And you can either send an email to myself or our scientific program manager, Ellen, and express your interest. Okay, I think that was not too long or boring. Just to sum up, patient-reported outcome measures bridge the gap between clinical measures and patient perspective, providing holistic overview of patient's health. Patient-reported outcome measures can help determine whether a treatment provides meaningful benefit to patients, hence fostering patient-centered drug development. Patient-reported outcome measures are scientifically valid and robust tools that provide patients perspective on living with a disease. And patients and their representatives actually can play a very proactive role in shaping tools like patient-reported outcome measures and driving innovation in drug development by staying informed and actively engaging in conversations about their care and support. With that, I'd like to conclude this talk, and I suppose we're taking questions.
Yeah, we're open to the floor for questions. Ellen, you're muted there if you want to unmute.
Sorry, if anyone has a question, if you'd like to raise their hand, either physically or virtually via the Zoom function, or feel free to pop a question into the chat box. And I know Nabin mentioned there's 2 ways of patients getting involved in contributing to this process through the EMA and the FDA, and we can share those links with you. We'll be sending out a communication early next week with a copy of the slides presented today and also a recording.
Yep.
And yeah, we have one question in the chat box from Nastya, and yes, the Education Hub training course is free of charge, and it'll be kicking off in December, and it's an excellent course. It's very informative, so feel free to take a look at our website, which has details of the course and how to apply.
Yeah, I know that was a lot, I suppose, and too much to digest. But if you have any questions after the talk or anytime, just send us an email, and we'll be very much happy to answer any of your questions in relation to prompts or any education hub or anything in relation to sort of developing any innovative therapies or care pathways and things. Just discussing anything about it, about the condition.
Nabin, would you like to maybe comment on kind of maybe the importance of kind of like developing prompts further, particularly given, I suppose, I mean, any of you who are familiar with the kind of the clinical trial space and kind of some of the announcements over the past few years, that a lot of, trials are, they're commencing, there's a lot of potential therapies, but they're just not getting past clinical trials. That's fair to say. This is what one of the reasons for this is the absence of prompts.
Yeah, that's a very good question, Ellen. Yes, certainly, as I mentioned in my talk, I think they're missing this patient perspective and how these therapies actually are benefiting the patient's overall health, overall kind of real world activities. Now, there have been some talks in relation to whether prompts would be used as primary endpoints or the secondary endpoints and things like that. But in the near future, I think prompts are increasingly getting recognized by these bodies, regulatory bodies and HTA bodies. And without the use of prompts, I think it's very unlikely that these companies will be able to get through past the therapies, because they wouldn't understand there's some clinical benefit, but does it reflect in patients' kind of day-to-day activities? So there's an increasing recognition of prompts in these therapeutic kind of approval processes, and we will see increasing number of prompts being developed, tools being developed and being utilized in clinical trials as well as in clinical practice going forward. But I think there's a role of patients as well, patient leaders, patient representative in relation to being proactive in being vocal about the implications of the disease, not just in terms of symptoms, but also in their overall health, overall kind of the things that I mentioned in the Venn diagram, where you have to deal with emotional element, social relationship, job and work productivity, and so on. So yeah, certainly there is a huge interest in prompts, and there's a need for patient involvement as much as possible in developing these new tools, so that they actually reflect what matter to patients instead of what matter to clinicians.
Nabin, thank you very
Yes,
much for
Marina.
the presentation. It was really good. I was wondering if you could mention for our community, because we have rare disease, most of our conditions, nothing yet in terms of treatment or our expectations and so on, and how much prompts are important, considering especially our context of rare disease in comparison with other type of conditions that are not rare, or maybe that has already some treatment on the market. And because when we talk about the prompts and importance, as you mentioned, and when we look at the rare condition, rare disease context, and regarding legislation, regarding how can we get these treatments approved, maybe could you explain better how relevant prompts can be for our community specifically? Is that
Yeah,
clear what I
exactly.
said?
Yeah, no, that's great. Thanks, Marina. I think, yes, the prompts are very much relevant, particularly in the rare disease community, because they have multiple issues. And even if you see a benefit in one particular element, the prompts will allow you to visualize what is the impact of that improvement in the overall health of that person. Sometimes there is no improvement in the clinical measures, but you can see the patient perceived benefit, because the clinical measure just the clinical test just measures one aspect of vision, but the improvement could be in a different aspect, which can lead to improvement in the patient's daily living activities. So it's even more important in rare disease space, where you have lots of alterations in visual functions, such as not just visual acuity. There is loss in visual field, there's loss in contrast sensitivity, there's loss in low luminance visual acuity, there's loss in color vision, and the clinical measures do not capture all these elements of visual function. But the patient-reported outcome measures actually capture the real-world translation of these different elements, which are not being captured in clinical tests. So that means even if you don't see any clinical measurements improvement in vision, which is a case in rare disease space, particularly in inherited retinal disorders, where you don't see a massive increase in the visual acuity and things, there could be some elements of vision that are leading to change in real world activities. So if you don't see the change in increase in visual acuity, this is the distance and vision, you can see that the patient is actually able to walk in familiar spaces, in bright light and those kind of things. So I think that's where prompts come in, particularly in the rare disease space, in IRD, inherited retinal disorders space, where there is no significant improvement in the vision, but still patients are feeling that we can perceive that we can see more, we can do our activities more, and this is where the patient-reported outcome measures come, because these all clinical measures may not capture the elements of vision that's allowing the patient to do these real-world activities that they're seeing with a therapy. If that makes sense.
That makes a lot of sense for me. I believe it makes for
Thank you
our
very much.
audience as well. Thank you very much. We have a good question on the chat. Did you see?
Sorry, hang on.
Yes, so this is from Anna. For those who are just beginning their advocacy journey, what initial steps does Retina International recommend in order to become eligible for such programs in the future?
Yeah, that's a very good question. Thank you so much, Anna. And again, as I mentioned, I think in my slides, you would have to get informed about the condition, about the whole landscape of bench to bedside. Means get as much information as possible. And I think I know it's tricky for people living with the condition because they're living with the condition, they have their own work, and at the same time, they'll have to do this understanding the condition, and get proactively involved in this kind of decision-making platforms. But I think the first step I would say is just get informed, get educated about your condition, about clinical trials, about patient registries. And it's impossible to learn everything at once, but this is a gradual process, building up your advocacy journey from step by step. So in the first instance, learning about the condition is a good step, and then build up on how therapies are being developed. So the clinical trials, what are clinical trials? What are the stages of clinical trials? Why does it take so long to get a therapy being approved? There are several stages of clinical trials which ultimately leads to the therapy of the approval of a therapy. And gradually, you can register yourself, even if you don't have that much of scientific background. You can in fact register yourself for the European Medicines Agency as a patient expert. And if they think that you are sort of eligible, they would invite you to review some documents, which will be, although they will be scientific, they will not be in plain language, I think. But still, if you get informed about the condition and get educated as much as possible, I think that will help you build up your advocacy journey. And then certainly Education Hub, Retina International Education Hub is a very good platform to understand your condition, to understand about all these steps in relation to, although it's a kind of a high level program, but it'll give you some insights and you can delve further into it if you're interested further into a particular element. So you might be interested in the clinical trials or patient registries or drug approval and regulation or natural history of the disease and things like that. So it gives you a very good starting point and some really good resources from world-renowned scientists and clinicians and patient advocates. So I think that's a very good point, good starting point.
And I think Retina International Education Hub is a good alternative if you are not European. I don't think Anna is European, if I'm not wrong. It was fantastic. Do we have any other question?
I don't see any more hands raised there.
Yeah, there's one just in, Ellen.
So this is from Jalal. Is there a relationship between genetic factors and retinal detachment? I have a daughter who showed issues in her blood vessels at the age of 9. She's now in her 20s. We noticed the same issue in younger sister when she was in kindergarten.
Okay, so this is purely a clinical question. So I would certainly request Jalal to consult with your clinician about their health condition, because we are not allowed to talk about clinical conditions in these kind of platforms. And so my sincere apologies. So you would have to go to talk to your own practicing clinician and talk about these conditions. Thank you so much.
I think that's everything. Marina and Vincent, we were going to suggest maybe we break for 10 minutes. We could start the careers session a bit earlier.
Perfect.
Sure.
Yeah.
Perfect.
So,
Thanks, guys.
So we see everyone back in about 10 minutes. In 10 minutes time, please.
Thanks, Nabin, for the great presentation.
Thanks, Vincent. I'm delighted. Thank you.
Thank you. So see you all in 10. Take the moment to grab a water, a coffee, just walking around. See you soon.
Hello, everyone. It's Claire speaking. We're just going to gently just let you all know that we're here and just wait for you all to join us after that short break. The panel guests are all here. I'm going to actually request that you will unmute and Vincent will introduce the next session. Are you ready to go, Vincent?
Yeah.
Okay, great stuff.
So hello again. Now we would come to the panel discussion on the topic of professional carriers with visual impairments. When we planned the event, we considered which topics would be important to everyone. We came to the conclusion that the career paths for people with visual impairments are something that many people are concerned about, precisely because it's particularly challenging for us. We have invited today 4 participants to share their experience and discuss opportunities and obstacles in everyday their working life to overcome. First, the speakers will introduce themselves to talk about their personal, professional backgrounds. Then we have prepared some questions that we would like to put to the group. And we would like to invite you to contribute your questions and topics to the discussion. You are welcome to write them in the chat or raise your hand. Ellen and Claire will then take care of it. So now I would like to start with the first participant. Cindy, would it be okay to start?
Yeah, that's okay by me. I hope everybody can hear me fine. So hello everyone, my name is Cindy Boer. I'm from the Netherlands. I'm also wearing glasses and I have brown, reddish, long curly hair. So like I said, I'm from the Netherlands. My current job is that I am a assistant professor in functional genetics or genetic epidemiology at the Erasmus University Medical Center in Rotterdam. I've been doing this, so I've been an assistant professor for 3 years now, but I've been working for 13 and a half years at the Erasmus MC, so 36, by the way. I studied biology, both my bachelor's and master, and after that I went on to do a PhD at the Erasmus Medical Center, and that is where I stayed in my career path. So I have Usher syndrome, which means that I am both hearing impaired and visually impaired. So I have been severely hearing impaired since my birth. And I only discovered that I was also visually impaired halfway through my PhD, but I first noticed that I saw very bad in the dark when I was about 18. Because my vision loss is progressive. So at the moment, I see about 30% during the day, and I think it's less than 5% at night. I think this is a very brief introduction of myself. So I'll give the word back to Vincent so that the other panel members can also introduce themselves.
Perfect. Thanks a lot. Nice to have you here. Stuart, you will be next. Would it be okay?
Yes, that's perfect. Yeah. Hello, everyone. I'm Stuart Haxel. I'm from Ireland. I'll give a brief description as best I can because I don't have very great vision. So I have short, dark hair. I believe I'm wearing a dark top, not sure the exact color. And I have blue eyes and I have fair skin. I currently work for the organization Fighting Blindness as an assistive technology coach on their new project, the Digitech project, which basically involves teaching blind and visually impaired people and the parents of blind and visually impaired children how to use assistive technology. I studied business at honours level in IT Sligo here in Ireland, and I went on to do a master's in marketing. That is nothing to do with assistive technology, but assistive technology has been a passion of mine for years since my eye condition, which is Leber's amaurosa, basically resulted in me losing vision over time. So I've had to learn how to use assistive technology and I've developed a passion for it. And I feel that it is my responsibility to try and give back my knowledge to people on how to use the technology, and I feel it can really open the world for everyone if they do learn how to use the technology. So that's a brief introduction to me. I'll pass back over to Vincent to introduce the rest of the panelists.
How long you have been working for fighting blindness in Ireland, Stuart?
I've been working for them for around 2 years. I have been volunteering with them on a number of different groups over the years, but on this particular project, they hired me at the beginning of this month, and last year I worked on a similar project for them, which was extremely successful. So we're hoping that this project will result in even greater results.
Nice. Perfect. Thank you for being here. Sebastian, would you continue? Sebastian, are you still there?
Sebastian, I'm afraid we can't quite hear you. I can see you are talking. Maybe it's the microphone. You're not muted. No, unfortunately, no.
Can you hear me now?
Yes.
Perfect. Yeah.
Okay.
Thank you, Sebastian.
Then I will work without headphones. I hope the acoustics is okay because the room is a bit, there's a bit of echo, but I hope that's fine. My name is Sebastian Sutter. I'm 33 years old, and I'm from Switzerland, and I work since now about 6 years as an attorney in a corporate law firm. My condition is RP. I grew up heavily visually impaired, and around 3 years ago, I went completely blind. I also have fair skin, blonde hair. I'm wearing my sunglasses, and according to my phone, I am wearing a light blue striped polo shirt with purple buttons.
Thanks a lot, Sebastian. So last but not least, Catherine.
Yes, hello everyone. So my name is Catherine Marash. I am 45 years old. I'm Brazilian. Now I'm living in São Paulo, but in the past I lived for 14 years abroad in France, England, and Belgium. I am blonde, I have green eyes, and today I'm wearing a white blouse with a red blazer. I've been teaching French for 13 years, and now I'm also working with massage, quick massage and quick relaxing massage. And I was born with optic nerve atrophy. So in one eye, I have 10%, and in the other eye, 5%.
Perfect. Thanks for the introduction. Nice to have everybody here. I would like to start with some questions. First, a little bit about general experiences and how to get to your job. I would like to know, had your visual impairment any influence about your choice of your profession or job search recently and choosing your career? Sebastian, would you like to start?
Sure. Just checking, you can hear me now, right?
Yeah, perfect.
Good. Yeah, I mean, I think it did have an influence. I think very early on in my primary school years, I wanted to become an actor, but because I already made compromise because of my visual impairment, I decided I want to be a voice actor. But that has never turned out to actually come to fruition. Then later on, I noticed that my main talent, I think, in school was usually sciences, so like more like natural science, but I could not see myself working in a laboratory or something like that. So I went, then basically another option would have been math, but math was just too, I felt that like that was like too boring and dry for me because it was just like numbers. And so that's why I chose a legal career, because people say it's basically math with words. And also it has a bit more of a human touch in it. And that's why I chose the legal career. And so yes, like the thought process that ended in me choosing this career, there has also definitely the visual impairment has been an influence there, that I was choosing something where I actually could see that I could actually provide value, which is of course because in law you have, it's a lot about existing knowledge, and it's also a lot about text, which is today one of the easier accessible parts of life with media, with AI and voice systems. You can usually access text much more easier, of course, still than images and other media, and therefore it's a part where the visual impairment, I think, has a comparatively low disadvantage. So yeah, definitely an effect.
So with all the new health stuff, with AI, as your profession gets easier for you, the problems have been a little bit easier over time.
AI has mostly helped me in my private life up to this point. As I said before, it helped me find out what actually the colors of my current clothes so that I can tell you guys, which I quickly did during this call when I noticed that this is apparently a thing that we talk about. And and also when it comes like to navigation, like I use AI, for example, to read billboards in a train station to find out which train is going is actually arriving at the platform and stuff like that. So in private life, it has definitely helped me. In the professional life, it's a bit more difficult because we cannot just feed all our data into AI because we have to deal with the attorney-client privilege, and then you can of course not put in data that then goes around the globe. There, it's more the conventional assistive technology that is helping me a lot. So optical character recognition programs in order to read inaccessible documents, and most of them I'm just scanning, having papers scanned so that I can read them. And AI is also a part in the workplace, but I have not yet used it that much in combination to cross hurdles for my disability at my workplace.
Mhm. And yeah, Cindy, I would like to know your vision loss was in the middle of your studies, right? So how did
Yes.
that influence your career?
So eventually, surprisingly to myself, not much. So at the time, so members of my family also have Usher syndrome, and they are really cool. They're awesome. My grandmother also has Usher syndrome this year, and she has never let it stop her doing anything she wants. Even though that, when I got my diagnosis, which was indeed in the middle of my PhD, it was in 2017, I really thought this was the end of the world. I really thought I'm studying biology. I'm doing a science career. It's really not possible. But I actually I had to come back from that entirely because yes, I cannot work in the lab. This is not something I can do. I cannot. I mean, I can find stuff in the lab, but I will probably destroy half of it if you put me in the lab. I will mix reagents that shouldn't be mixed. But that's fine because also within biology and the field that I'm working, actually 99% of your work is actually computer based, which just like Sebastian said, we have lots of technological assistance for that to work on a computer. You can zoom in on text, you can let text be read to you, and this is really great. And I actually found out, well, actually my work is not that much in the lab, but if I need to do something in the lab, we have a whole, I have students who would love to do things in the lab for me, or I have technician or other people I collaborate with. So the lab work is not my strength, but there are other people where computer work is not their strength. So in this way, I could actually combine my strength with somebody else's strength and still get to the goal I wanted to go to. So I do have to say that this I needed a lot of help to get to this point. So this is from family members, colleagues, other professionals to help me realize this. And it also helped a lot that I was very open about it. As soon as I got my diagnosis, I told it at work. I told it, and I was very fortunate that I have very awesome colleagues who were immediately, their first answer was, okay, what can we do for you? How can we make sure that you can do what you like to do? That's not to say it's been super easy or that there's sometimes still challenges. So, for example, I go a lot to international conferences, and this is always, and I think many of you know, traveling is always takes a lot of energy, especially if you travel to another country. This takes a lot of arrangements. And what has helped a lot is that I stand up for myself. So at the moment, I get invited to go to conferences, and then I just tell the organizer, look, you can invite me, that's fine, but I have to bring a guide with me. So if you want me to be there, you also have to get a guide there. So that helps a lot. Yeah.
How was it for you to stand up and ask for help and communicate that to your employees and working colleagues?
Terrifying. Absolutely terrifying.
Mm-hmm.
Yeah, so what I found the most terrifying, so at first I did it just at my job. I first told my direct supervisor in private, and I said, you can't tell anybody, just you, just you. And then it took me, I think, 4 months to be able to say, okay, now we can tell the rest. Now you can tell everybody else. And I remember the very first conference I went to where I had to use a cane. I was really terrified. I was like, what will people think of me? How people might think I'm weak, or but this is really not the case. This is really not the case. 99.9% of everybody is super nice. And actually, it helps a lot more. People are much more understanding if you want to look at something more closer, or if you bump into them. Or as I apparently have done many times, rudely cut the line for the coffee machine because I don't see the line for the coffee. So yeah, and I do want to say here that the courage for me to do this actually comes from Retina International, because actually one of the first things I did, so I think half year after my diagnosis, there was the Retina International New Zealand, where I actually met Sebastian in person. And some other viewer also here. And that actually really helped me to be like, look, we're just cool. We're just people, and you can do whatever you want. So let's try it.
Nice, nice. Because that's a question which I have to figure out for me, because I work with patients as a physiotherapist, and yet I don't tell my patients, or just occasionally, that I have vision loss. I don't see that often, so it's for me. It's also I'm right now processing it, how I can communicate that, and I'm always wondering how other people communicate that to people around them. So thanks a lot for sharing, Catherine. How about you? How does
Yeah.
has it,
So, mhm. So before going to the university, I worked as a babysitter, and then I worked as a secretary in a medical clinic. Afterwards, I decided to apply for physiotherapy. So, but at the end of the first year, I changed my mind. I said, "No, I think this is going to be too hard for me," and I decided to go for languages. So I went to Bristol to improve my English and to have an experience abroad. And there I started working as a kitchen assistant. Afterwards, I found a job in at Bristol where I worked as a guide. After that, I came back to Brazil, and then I went to Belgium. And in Belgium, in Brussels, I worked as a telephone operator for three years. Yes, and then in 2012, I came back definitely to Brazil. And here I have been working as a teacher for 13 years. I'm working now with massage for 3 years. So things came out like this. I didn't think about doing all these things, but at the end, I just took the opportunities. But it's true, when I wanted to choose what I wanted to do at the university, it was quite hard because I said, okay, and now what can I do with my vision impairment? Which job would be a good one for me? But as I always wanted to work with people, and I always liked biology and so on, I thought, okay, physiotherapy will be a nice thing. But afterwards, I went for languages.
You still work as a language teacher as well?
Yes, I give
Yeah.
French lessons online.
Très bien.
Vous parlez français.
Un petit peu, hein? And how do you work as a language teacher? What is different? What's different, or is there any like different method you're trying to involve in your teaching?
I've been working with different ages, children, teenagers, and nowadays I'm especially with adults. First of all, I worked in schools, so I went there every day. But nowadays I'm giving classes online. It's much more practical, and I can use my magnifier on the computer and my portable magnifier. So for that, there is nowadays it's very practical with the technology. But when I think in the past, when I was at school, it was so hard because I didn't know about any technology. My parents didn't know neither. So I just had a simple, very simple magnifier for study. And I did all my studies with a simple magnifier. Like I had strong headaches, but when I went to England, to France, and to Belgium, I find out about this very good technology, Zoom on the computer, video magnifiers. So that helped me a lot, especially for work. When I worked in a hotel in Belgium, I had the help of an association, La Ligue Braille. They helped me a lot to find a job. And in Bristol also, RNIB helped me a lot to keep my job there.
Thanks a lot. Stuart, how about you? How about your marketing studies and
Yes. Yeah.
how went
Yes,
everything
that
on?
was. Sorry, continue. Sorry, I was interrupting you there. Sorry. uh, Basically, throughout my education and marketing studies and business studies, I used a lot of assistive technology all throughout. Like because I was born with my visual impairment, I've had to learn how to use technology from an early age. I started off using those magnifiers, and then I went on to using my laptop with JAWS, and that's where I really started learning about assistive technology, how to try and make things accessible for myself throughout college. A lot of the software and stuff sometimes wasn't accessible. I had to figure out different ways of making it accessible and trying to communicate to lecturers to help make that accessible. And when I ended up finishing my studies in marketing and business, I think I got a bit tired and burnt out of it, so I didn't actually pursue a career in business or marketing. And then in 2020, COVID hit, and a lot of different things went online. And in particular, I started joining assistive technology groups. And I found that a lot of the knowledge that I had learned can actually help a lot of blind and visually impaired people. So since 2020, I've been helping on a lot of different groups, and Fighting Blindness approached me and asked would I like to be an assistive technology coach on some of their projects. And based on what I had done over the last few years, I realized I had a passion for coaching and trying to help people learn how to use assistive technology.
Mm-hmm.
I hope that was all coherent and understandable.
That was
And
perfect.
yeah. And I actually studied French in college as well. Funnily enough, it was actually part of the the curriculum. So I do have a bit of French.
We won't do the panel in French, or
Thank
maybe
you,
next
thank you.
time.
It's been a few years, so I don't know how much I remember, but I did I did actually really enjoy French when I did it.
It's not. It's really nice language, but
It is. It is.
you were providing blindness, and I heard like from the others that the supporting systems like Retina International or the national systems are really important. What do you think? How those organizations could help the people even more? What's missing, or what could be improved?
I definitely feel like organizations like Fighting Blindness and RNIB and all the other organizations like Vision Ireland are very important because they help bring people together. Like they can organize groups online or in person that would gather people who live in remote areas who are not usually able to meet other blind and visually impaired people and basically help them interact and learn about technology and open up their world. They're vital organizations, and they do this. They serve a vital purpose.
I know in Switzerland it's quite hard to get in touch with the people with visual impairments, especially with young ones. What do you think? How the organization could get more in contact and could ask them or could involve them more in the national groups and helping system? Because I'm as well in Retina Swiss in the youth group, and it's always kind of tough to bring people together, and especially for young people in with visual impairments, which is still in processing. They're not sometimes not like don't like to get involved or talk about it.
It can be tricky, all right, but I'd say this probably go back to a bit of my marketing, probably promoting on social media sites and trying to reach them through that, because I know with how accessible a lot of these places have become through like voiceover and iPhones and everything, a lot of them would be on groups on places like Facebook and stuff like that. So probably reaching out through there would be a very good approach. And I know a lot of them do that, but probably maybe increasing the level that they do.
Yeah,
Mhm.
I just feel that
Yeah,
in our Swiss group, it's kind of how can I say, a challenge to get people
yes.
together and talk about it. And I think we have a question from Melissa Wang.
Yeah.
What advice do you
Vincent, do you want
have?
me to read it out for you?
Yeah, you can.
And there's a second one on the Q&A. So the first one is, what advice do you have for those changing careers or new jobs but want to disclose your disability from the start? This question comes from someone who hasn't officially disclosed themselves as visually impaired.
Who wants to answer?
Is that for a specific person? Sorry, that's what I was going to
I think
ask.
that's generally to the panel. And then there's a second one, and it's from Stacey, and she said, first of all, thank you everyone for sharing your stories. You're all a true definition of resilience and courage. My name is Stacey, and I'm a clinical research assistant at the Oregon Health and Sciences University, and I'm currently studying Usher syndrome 1A. My question is, what can the healthcare system do better to diagnose and help patients like you, and what resources do you wish were made to help you in your personal and professional careers?
I could
I
maybe tackle the
already.
first of those two
Yeah.
questions.
That would be great.
Yeah, sure. So, for example, when I applied for my jobs, I did not disclose my disability in the beginning. I did not include it into my CV or cover letter or anything like that. But then usually what I did is when I got an invitation to an interview, that would usually be a call. Somebody would call me and ask if the appointment works, and then I would usually tell them, because because I think it's easier through a phone than in a paper. I'm going to come back to that. And secondly, just because basically I was afraid if I put it in the letter, they will just deny me. And if they are calling for the appointment and I then tell them I'm visually impaired, they cannot really be like, oh, okay, in that case, never mind, bye. and that's why I usually only disclose it in that short call for the appointment. That worked so well far. In like the only one big phase where I really searched for jobs, I got like about 17 interviews, based on a roughly 130 applications. So that was roughly an interview in every seventh or eighth application. And then means still some of them said then that the visual impairment was a problem, but not all of them. So it's hard to say how it turned out, or if it would have been better if I would have put it in the letter. What I think is a really cool workaround or solution for this problem, which the Blind Foundation in Switzerland actually offers since about 1 or 2 years. And I'm guessing there are many people here on this call who have ties to their own national versions of Blind Foundation. So this could be something you could propose to them if you find that interesting, because I think it's very helpful. And this is that you actually don't apply with a letter, or not only, but also with a video. So they call this basically a video application, that you send your potential employers a video where you do a short clip with yourself, where you basically talk about yourself and present your strengths and everything. And the main point of that is because people who look at your documents often have never gotten in touch with any kind of disability, really. So I still think that when you put it in the letter, there is a certain amount of danger that they will just be like, I have no idea what to expect. That's totally unknown to me. Unknown is uncomfortable, therefore I don't pursue the application. But when you make a video where you present yourself, you can already basically tackle some stereotypes, because, for example, you can prove that you can talk straight, that you look like a normal person, that you have all the general abilities that most people have. And of course, if you have any other disabilities, then you can disclose them right away. Basically, what you do is you can already show them, these are my limits and these are all my limits. And they don't have to expect anything else that they don't know. And therefore, I think that's really a important tool. And if I would actually quit my job and have to search for a job again, I would definitely do that.
Nice. Perfect, Sebastian. Does anybody else wants to add something about the disclose?
Yes. Yes,
Cindy
please.
has her hand up there, Vincent.
Yes. So I want to fully support Sebastian's position here. I also think that what I did myself, so I've been hearing impaired my whole life. So every single resume I had to hand in, I always had to think about this, but then from a hearing impaired perspective. And I always did the same. I was like, I'm not going to give you my disability to read, because indeed, as Sebastian very aptly puts it, most people don't know or don't realize they have ever seen or met or interacted with a person with a disability. So they probably only have some stereotypes. Oh, you can't do this, you can't do X, you can't do Y. Well, actually, you might actually can do all those things, maybe with a little bit of help, but it's much better if they hear it from you. And indeed, what Sebastian says is they have invited you. They cannot have their judgment uninvite you, right? You are there, you can show them what you can do, and you can actually defend yourself. So unfortunately, there will still be some defending yourself is needed. But I also agree with Sebastian, and the tip he gave, I think those are very good ones.
Sure, Catherine, anything to add about?
Yes. In my case, I preferred to write down on my CV that I was partially sighted. I said I told myself, okay, it's better that I say straight away and then to arrive there, and they are going to see that I'm partially sighted anyway. So I prefer to do it this way. And I was very lucky because I was always helped by the organizations, even in Bristol and in Brussels. So they helped me a lot. I didn't need to send many CVs. It was something quite easy. Not easy. It was not easy, but I didn't need to look a lot for a job. I was helped for the, about by them. And even here in Brazil, when I was a secretary, I knew someone and she said, "Oh, would you like to be my secretary?" "Oh, okay, let's go." And I did everything on my way. So, and then when I decided to become a teacher in Brazil, I had already all my materials here, my magnifiers, my video magnifiers. So I just went to schools and I said, okay, I'm partially sighted, but I have already all the technology that I need to work. And they accepted and I started working. So it was, I can say that I was quite lucky. But I needed to work very hard because many times, all the time, I was the only partial sighted people at school, at work. So it was quite hard because I needed to know myself, my strengths, my weaknesses to be able to explain to people what I needed. Because many times people, they don't know. First of all, they are shy to ask you, "Oh, you were partially sighted, but you don't use glasses, you don't use a cane. How come?" And I said, yes, I am, but I know already. I was born with optic nerve atrophy, and now I know how to do things. But at the beginning, I was very, very shy, even at school. So when I needed to take my magnifier to read, to read my papers, or to look at the blackboard with my binoculars or monoculars, wow, I was extremely shy. But with the time, I said, okay, Catherine, you are like this. People need to accept you how you are. So let's go. And that's it.
Stuart, anything to add?
I would tend to lean the same way as Catherine. I like to disclose all the information on the CV from the get-go. I just feel personally it's good to have all information on the table so that the interviewer is not going in there with not knowing what to expect. I think if you're going in there not disclosing all the information, the interviewer might feel like, oh, well, you didn't tell me this at the time. What else are you not telling me? So it could already start off on a bit of a bad start going into an interview with information that was not disclosed. So that's just personal opinion. I do feel the points that were raised by Sebastian and Cindy, is that the other name? And I feel they were very valid points as well. But personally, I would lean towards disclosure.
Mhm.
Mhm.
Mm. I think it's all about how do you feel with it? If you feel more comfortable with disclosing, I made experience it. You lose stress when you disclose it. I just example of my uncle. He was trusty, didn't tell anybody, and at some point when he was working, had really problems, but still don't doesn't want to tell, and he had given him so much stress. And at that point, you should really try to disclose. That's my opinion. Ellen, I
Yeah,
don't
we have a couple of questions, Vincent. So the first, there's one here on the chat.
that one you have in the second one is also answered within.
Um,
You had two questions
we
before.
had, sorry, bear with me a second. So sorry, the question was about the healthcare system. What can the healthcare system do better to diagnose and help patients like you? And what resources do you wish were made to help you in your personal and professional careers? And I suppose another there's been a couple of other questions here in the chat about things like, you know, what accessibility supports at workplace adjustments have made the biggest difference in professional life. And also there's a more specific question about saying, you know, for people who have a career that requires a lot of moving around the workspace, has a guide dog helped you or made it more difficult? I think there's a few areas there in terms of accessibility in the workplace.
Let's go with the first question. What about the healthcare system? What you would like that the healthcare system in your land would do that make your life, especially your professional life, your working life, better?
Can I respond to that?
Yeah,
Is
of
that
course.
okay?
Thanks.
So I think in general, so I'm from the Netherlands, and I think at least I had a very positive experience, which I'd like to share because I think this might help be beneficial for other countries, other people's too. So what happened with me was when I got my diagnosis, I did unfortunately had to wait 6 months before I could see a specialist. That was the downside. But the good side is that in the Netherlands we have an organization. It's called Visio. So it sounds like physio, like physiotherapist, but it's with a V. And what they do is psychosocial help. You can go to them once you get the diagnosis, or if you already have sight problems, and they can help you on a psychosocial level. But they also provide direct links to all other help organizations that are there in the Netherlands. So for instance, if you need a discount pass for the public transport, or for instance, the job that Stuart is doing. So if you need help with what kind of technology can assist you, they can immediately provide you connections and appointments to people who are doing that. And that has really, really greatly helped me. I'm not sure how situations in other countries are, but for me, this was really good, and I hope other places can and will also offer such help.
Great, thanks. Anyone wants to add something? Then I would like to continue with the next question. For people who have a career that requires a lot of moving around the workspace, has a guide dog helped you or made it more difficult? I don't know who has a guide dog actually of you four.
I don't have any.
I don't have one. I used to have one, but I'm using a cane now.
Mhm.
And
I know Sebastian has also not don't has a
My sister
dog.
has
No?
one, as you know.
Yeah, I know.
Well, I think based on the answers, I think Stuart would probably be most qualified to answer the question. I can just say what my sister says. When you have a guide dog, you don't just have a guide, you also have a dog.
Yes.
You need to be aware that um, a dog needs care and this costs time. So if you think you should get a guide dog in order to save time, that's not going to work because you're going to lose the time you're quicker in walking by caring for the dog. So if you get a guide dog, you have to do it because you also like the idea of having a companion and having to care for them and do the work that comes with it. Otherwise, just as a navigation solution, it doesn't work. But of course, if you are liking to get a dog, then it has an extra benefit.
I would fully agree with you there. Like, and other considerations are how would employers react to having a guide dog in the workplace? Like, I know that they are obliged to let you work with the guide dog in the workplace, but how would they adapt to having a dog in the workplace? Because they'd have to make sure there's areas where the dog can go to the bathroom and stuff like that. So that's another consideration that they'd have to take on board if they were to employ someone with a guide dog.
I'm not sure if we have all the questions from have been answered that we have from the audience. If Alan, if so, I would like to have another question.
Yeah, Vincent, suppose if there was, I don't know if anyone on the panel wants to add about that, about the accessibility supports or workplace adjustments that they found, useful. Or what advice would you give to young people living with vision loss who are thinking about their future careers?
Is there anybody wants to ask of those questions? Anything to respond to that?
My job is remote, so all the adjustments and stuff like that are done at my own home. So I have all that set up here. So I don't really have good answer to this question.
In my case, it was basically that we have the social security system that provides the alterations that you need in the workplace. And my employer didn't really have to do much with it. It was basically initially when I got my job, I told them like we have like this whole toolbox of potential measures that we can implement. And my future boss was basically yeah, we just make you this, we just present you with this offer and you can take it, and anything you need, just have it implemented. It's like, so they did not really spend much time with it, but they also didn't like set any barriers, because we are like we are a big firm. So basically, when I need something with assistant technology, then I just contact the relevant social security departments and see that somebody comes to my workplace, for example, like doing a JAWS update, or when I get a new hardware, for example, to install JAWS on the new hardware, something like that. And then it's basically just that I have to have somebody from the IT department who provides the hardware, and somebody from the social security contractor who provides JAWS, and then they basically work together to install everything. And like my supervisors don't really get any information about that. It's just like I basically manage it myself, but I also have the freedom to manage it myself. So yeah.
Nice. The second question was about, I think, was about advice for younger people who are choosing a career. In which field you would recommend, would you say are the most opportunities? Which one would you say has big chances to be to build up a great career?
So if I can go first, I
Of course.
I understand your question, but I'd like to go a little bit against the question. Because so living with a handicap means that regardless of the career path you're going to choose, there will be hurdles. So this is just the case, right? So most of the time it will go well, but we'll all encounter hurdles. And my vision is that, at least my view in life is that you should choose something which you are passionate about, where your strengths are, because in that field, that will be the place where you will be able to shine and actually overcome those hurdles, or have the energy to tackle them, or to find the solution so that you can still do it. So my advice would be to go search for what are your strengths, what are your interests, and then look, okay, what do I need to do, or how, like, what help do I need, or to do to get to that goal, rather than say, this field has a lot of opportunities. But that's just my view on it.
Completely concur, Cindy. Do something you really love.
Yeah, so I do something I really like, which is biology, right? So, and this might be a field that most people won't think visually impaired person could work in. My mother recently told me, yes, but Cindy, this is not really a valid argument. What if you wanted to be a race car driver? And then I countered, there are actually 2 blind race car drivers in the world. So the chance is low, but it exists, right? So, or you can find something else. It might be adjacent to your interests.
Great answer, Cindy. Thanks a lot. And if anybody wants to add something about it?
Oh, I agree totally with her because the most important is that you love what you do. If you and you need to know your strength and your weaknesses. So, and if you are not shy to share with people what are your needs, there are big opportunities for you. For example, there are photographers, blind photographers, people who are blind who do dangerous sports. So I think we just need to be creative to be able to adapt this job for ourselves. Of course, I think a surgeon or a cashier for me it would be. I wouldn't be able to be a surgeon, okay, but I can do other things. I just need to think about how can I do it? What are the technologies that I can use to have this job?
Mm-hmm. Good. Yeah, it's kind of interesting questions. I thought about that earlier. Thanks for his response. We have 2 comments I see on the chat. The one is from Melissa Wang. This question is on mental health. How do you try to cope with the new changes of your vision loss? I also have Usher syndrome with RP. I think mental health is a big topic right now as well. Yeah, what do you think about the question?
Can I say something about that?
Yeah, Leo, right?
Yep, that's me. Sorry. Okay, I'm Leo. I live in the Netherlands. I'm 52 years old. And the thing that helped me most to regain my strength is meeting other people with the same eye disease. I have IRP. I felt really lonely, and that really that had a big impact on my life. I went to Cuba for this very strange therapy in the mid-90s. And the thing that helped me most was meeting 60 other people with IRDs. Together, you're strong. And I have been fortunate enough to visit Iceland and Dublin for the Retina International Youth Councils, and I've been taken into the group with a lot of love and a lot of care, and I really love that. So meeting other people and sharing time and having fun together, that's the thing that helped me most.
Mm-hmm.
Thanks for listening.
Thanks a lot.
I would say having your support system there, so having the people around you who you can go to, who you can share fun with, but also your bad days, right? If you have a bad day or if something you need to accept that you can't do it anymore, that you have your friends, your family around you to support you, and be open that might be a bad day for you or a bad moment in time. Because I found that when I had that I was struggling with something, I was very sad that I couldn't do something. My friends and family actually would come with creative solutions for me that I hadn't thought about, but has helped me greatly. So, for example, my boyfriend, we have a dog, just a house dog ourselves, and I can't walk him at night. It's a black dog, not a smart choice if you're vision impaired and blind. That's also a small dog. It's also not handy if you're visually impaired. But he actually made me night vision goggles, so I can walk the dog at night now. I would have never thought this would be possible, but he made them specifically for me that I can use them and walk the dog, right? So it is a big thing for me, but maybe friends or family members or others around you can help you, even if it's just a cup of coffee you share where you can discuss your problems.
My point is basically, I think what I want to put in is just that focus on the things that you can do. I always like that one quote from Stephen Hawking. I guess most people know him. He was like the astronomer who suffered from a disease that basically made him unable to move anything but his eyes. I think he died a few years ago. He was just famous because he used one of the first automatic machines to speak. And there was once a situation where somebody asked him, like, you say you don't believe in God. What actually keeps you being active every day and moving and doing stuff? And his answer was basically, no matter what actually what crises you face or what happens in your life, there's always something you can try to achieve and pursue. It really doesn't matter what that is, and then you should focus on that you basically just try to achieve whatever is next to you, and that can just be of like achieving to get food or just get up in the morning or anything. It can be as trivial as anything, and then when you have achieved it, then you can focus on the next thing, and that keeps you going. And if there's like activities that you cannot do anymore, then I often noticed for myself that it helps to basically just take an activity that you maybe miss because you can't do it anymore, and take it apart into its fragments and then see, well, which of these fragments can you still do? For example, let's say you're a passionate bird watcher and you make pictures of birds and you catalog them or whatever, and you really like them, then you go blind and you can't really take pictures of birds anymore. Then it's like, okay, what is it about? It's about birds, it's about nature, and it's about information. So you can still go into nature and listen to the birds. You can still maybe also have a bird or something which you could touch, and you can still read up on birds and build like huge knowledge. So you can't really do the exact activity anymore, but you could still do like many of the fragments that make compile this activity, and therefore probably get a satisfaction that is close to the satisfaction that you had when you were doing that activity.
Anyone wants to add something about the question about mental health?
I'd fully agree with all the points that have been raised. I think having your friends and family that can support you on your good and bad days are very important. And regarding Sebastian's point about if breaking it down into bits of the activities that you can still do, I think another good approach is to maybe try and find a way to, like, either using technology or another way. It's like, how can I do this activity in a different way? Is there a way, like, I might not be able to do the activity in the way that I used to be able to do it, but is there a new approach that I could use that could get the same results? I think it is very important, and all the other points that were raised about it are vital.
Hi, can I add something to this mental health discussion as well, if that's okay, Vincent, if you...
Of course.
No, and I also would like to thank you. It was very nice to listen to all different perspectives and see some nice, friendly voices here. Nice friendly voice. I miss you all, guys. It's nice. For those who I know and for I don't know, too nice to pleasure meeting. What I'd like to say is that when something happened, and because the vision loss, we face a challenge, we face a barrier, and we get sad, or we get upset, or we get anger, whatever feelings that normally we don't like to feel them. First of all, I think it's part of life to feel anger, to feel sad sometimes. It's not a problem in itself. And also, I like to remember myself that I don't have a problem. I'm just a person living in the world, and humans are diverse. Nature is diverse, right? Disability is part of nature. So if there is a problem, the problem it's there in the society who's not able to actually include all of us in a proper, dignified and I don't know, more empathy way of doing things. We know life is challenging and we're gonna face those barriers, we're gonna face those feelings and so on. But I personally like to remember that there's nothing wrong with me. There is something wrong there, not with me. And besides that, I like to remember that life is about experiencing things and learning and meeting people and really experiencing it. So if I'm experiencing something that it's bad and I'm sad, and sometimes I just be anger and be sad for a couple of days, but what can I do to make me feel better with these feelings? What can I learn when I'm not feeling very good? And keep remembering that happiness, and this is something that we like to achieve, we search for, but it's part of life. So I just like to be patient and sometimes accept that okay, I'm sad. This is not because of me. There is nothing wrong with me. What is wrong is the word that is difficult. I myself alone, maybe I will not change that, but I will do my activism, I will do my advocacy in the way I can, and I will digest that feeling and I will move forward because life is beautiful and there's so much amazing things to do and to experience and to meet people and to learn. Imagine how many things we can learn and imagine how much technology that exists in the world that can help us to adapt and how many things we can do, and maybe we want to change and then we change and we do another thing. So I like to, when I'm facing a barrier and when I'm sad because I'm facing this barrier and when I'm facing this barrier because of one of the disabilities that I have, I like to remember that there is nothing wrong with the way I think. There is nothing wrong with the way I see the world. I'm just a little bit different from the majority of the people, and that's nothing wrong with that. That helps me. Maybe it will not help you, but that helps me.
Exactly. Can I add something?
Of course.
There are two sentences that helped me a lot during my life. The first one is focus on what you can do and not on what you cannot do. And the second one is I always told myself like this in hard moments, Catherine, you can do everything that you want to. You will achieve everything that you want, but in a different way. So let's find out this different way to achieve what you want. So these two sentences are still very good for me.
Really nice. Yeah. I think we're running a little bit out of time. Ellen, maybe you have
Just
lost a
one
little
more
bit
question there
overview.
that maybe if someone wants to answer quickly, and it's from
Yeah.
Stacy, and she says, it sounds like you have all been very brave and advocated for yourselves, but what knowledge do you wish people already possessed about visual impairment? Is there anything that comes to mind?
I'd say the first thing that comes to mind is that we're not all the same. Each person with a visual impairment and who are blind, we're all different. We're just people. Like, we just have something that's a bit different that we have to live with, and we're all different. We're not all the same.
Absolutely.
Maybe that our other senses are not automatically heightened, because that's a real stereotype that we
Yes,
always
yes, yes,
encounter.
yes. I fully agree. I've heard that too many times.
Yeah, that's a good one.
Uh,
But I would also like to say that is I know what my limitations are, but I also don't know every day what I can and what I cannot say. Sometimes I see things, I can do it someday, and the other day I can't, and then the next day I can. So what I would like people to understand that being visually impaired doesn't mean that I'm blind. It means that I'm sometimes not seeing things, and it's sometimes very complex to explain what you can and cannot see, and that is very individual. So I can read a book, I can't drive a car, and this is sometimes very complex for people to understand. And I wish there was a little bit more empathy for that.
Mhm.
Great. So yeah. So Vincent, we're just we've at our time now, so we'd like to close the session.
Yeah, thanks a lot. It was really amazing. Really enjoyed the conversation with you. I wished we had more time. I think there are would be a lot of more questions, but I think they were really good talk, good discussion. Thanks all for that.
Guys, it was really amazing. Thank you everyone for coming, for taking the time. Time is so precious today, right? So taking the time to be here, having this discussion, having these talks. That means a lot for not us, but for the community. So thank you very much. Thank you. Thank you.